A daughter, a sister, a sister-in-law, and a extremely beloved atte to our niece. A legal researcher, a fantastic team builder, a team player, a great friend to many, my own first cousin, and a most integral part of our close knit family. Kritika took on every aspect of her life with grace. Um, Whenever she had entered any room, she only had goodness to share with everyone around her. With all the happiness and the goodness in her life, there was also another part and aspect to her life, which was a lifelong battle due to pulmonary issues. In 2021, she underwent a great medical challenge, a bilateral lung transplant, commonly also known as a double lung transplant. While this was a challenge, it gave not only her but all of us and everyone around her a gift of 3 extra years that we have made so many memories with her during those times. She has explored life all over again with new grit, new determination, and we have known her to never give up anything in life. And she showed us that even a great medical challenge such as a lung transplant wouldn't, you know, wouldn't dampen her spirits. Those 3 years were no less than a blessing and a gift to her and everyone around her. Today marks 1 year since her passing, but we always look back upon the gift of time we all had. Honoring Kritika, the memories shared with her, her life, her legacy. Today we want to explore, understand what organ donation can provide, how it can be a blessing to the patient and the patient's family. And to help us understand more, today we have Kritika's father, my Dodappa, Shiv Kumar, to help us understand and answer the questions that we may never have asked otherwise. So, yes, Dodappa. I know it's a difficult conversation to have, but it's also an extremely important conversation to have. You know.
Losing a daughter is a great pain for any parent. But to continue her legacy, to make people aware about the organ donation, I will share whatever we went through during that journey of transplant, lung transplant and other things. Per se, organ donation has a wider meaning. It doesn't restrict to only lung. There are eye, you can donate skin tissues, you can donate kidney, heart and other things. Today specifically I go through the experience I had with lung transplant with Kritika had during 2021 September. So I will share whatever I know. As you know, this is an emotional moment for us also. There will be some slips here and there. Hope you understand that and bear with me if there are anything.
Of course.
Basically, Kritika was suffering from this lungs issue, pulmonary issue, when she was 3-year-old. Since then, she has been battling this issue, and slowly it got a kind of deterioration happened and other thing. So in and out of hospitals for a couple of times in a year, trying to find out a solution for this. Actually, the issue is called bronchiectasis. That there will be some scars and structural damage to the lungs and other thing. So if it were to be localized, it could have been removed by way of surgery, normal surgery. Since it was spread out, so surgery was not an option. So she had to endure that suffering over a long period of time, and it only by time it start deteriorating and all these things. So we were visiting many hospitals, many doctors and other things. Fortunately, we have a family doctor within us who always have been guiding us in this aspect of her medical condition and everything. So when we went to specialists, pulmonologist and all these things, we went to Apollo Hospital, to be frank. And the doctor, for the first time, somewhere in 2018, I think, he just asked us to explore the possibility of transplantation, lung transplantation. But that time, to be frank, in India, it was in a very infant conditions. I mean, situation, no much thing was known about lung transplant. Only few hospitals in India were doing that and all these things. There is a process for lung transplantation. It cannot be just I go there and they are ready to do it and all this, because patient's condition is very important to undertake this.
Right.
It's a very complex surgery, because as you know, it's about lungs, and lungs means breathing. So the infection is always there because you breathe. When you breathe in, you take all the impurities and other things. The bronchiectasis, the main problem was that she was not able to throw out the carbon from inside. So it used to get settled in the bronchioles, what they call it there. So they said first there have to be evaluation to know whether patient can undertake this surgery, and also whether she is in a fit condition to do it. So we did one preliminary evaluation. So doctor said, though everything was okay, if not good enough to get into surgery, they said still they can go about it only when she improves her weight.
Okay.
Because she had lost, I mean, she had from childhood, she has been a very low weight category kind of a thing. So they said let her increase her weight, and then we will explore the possibility of this. So it started there, to be frank. That was the first process we got into as far as the transplantation is concerned.
So 2018, first time ನಿಮ್ಗೆ ಗೊತ್ತಾಗಿದ್ದು what organ donation was all about, and you got that first advice that this is something you should be exploring.
Yes, yes.
And it was in 2021 that she actually underwent the transplant itself. So I can't imagine how much you must have researched, learned and explored in those 3 years to finally come to that day and that decision. So if you can break it down for us.
Yeah, we were little hesitant because we didn't know what is transplantation.
Fair
We
enough.
have heard only about kidney.
Correct.
And here and there some liver transplant that had happened. But common sense says that lung is a very difficult organ. In the sense, I don't know how do they remove the lung and how do they replace it and all this. And so these complications and other things were really staring at us, whether what we should be doing. See, getting a solution is one thing, but how practically we can go for it and all these things. But as you know, Kritika was a legal researcher. So she started researching on her own. Forget about me. She did more research than what I could gather from outside. She did lot of research on medical this one. She joined US some association. She joined some groups where they were telling all these. She was getting information about transplantation.
Okay.
It's
Support groups.
Support, not only support group, those who were really from the medical field.
Okay.
So there
These are
was-
not donors and donees.
No, that was a later
that also
later
happened.
part. So initially about the taking decision whether we should go for or not.
Correct.
Because to get into those things, donor donee kind of a thing, it was too early for us. And then there were very little and a few people who had undergone.
Correct.
So there was no much number where we can fall on something and then get information.
Yeah.
It is only through the doctors what we used to get and what research we were doing. So it was really a thing that I think she has done more of medical research than legal research. It was so happened, one of the doctors used to jokingly say, when Kritika's appointment is there, I should be ready to answer her question because she would raise so many questions on transplant and other things.
Yeah.
So such was her understanding of this one matter. And then matter went little deeper into our consideration and other thing when we were discussing about it. So we said, okay, we can think
about it, yeah.
think about it and other thing. Now, who is going to do it? Which is the doctor? Who is the surgeon? Kind of a thing. So then, again, doctor suggested we went to Hyderabad, we went to Chennai to discuss with the doctor. Global hospitals in Chennai, then Yashoda Hospital in Hyderabad.
Nice. Okay.
Plus in Apollo Bangalore, we were doing all these research we were doing and all these things. Because her treating doctor was in Apollo, Bangalore. So under his guidance, we keep on meeting various doctors and other things. But still we were unsure.
Especially, it's so important to go for an informed decision when about somebody's life, and the lack of information must have also been so much
because
to get
there
to.
was it is all whatever we used to get some medical journals and other thing which she used to research and get it, and whatever doctors used to tell. I know doctors, they do their best for their patients. Correct. And if they feel that it is the only option, then we have to accept that.
Yes.
But whether to accept that decision in getting the surgery done or not, it's a family decision.
Yes.
So, because one more thing, let me tell you, when no doctors were very convinced in the sense because of her weight problem.
Right.
Whether she can go. So, the choice was left to us. So, now what do we do?
Correct.
Surgery is an option, but her medical condition is not allowing her. So all these things were happening. We tried everywhere, we tried and all these things. But we have to say yes or no to the surgery. And then we asked the doctor, what are the success rate? What is the success rate for this transplant and other thing? I mean, this particular doctor with whom we were who was treating Kritika, he was quite open. He said 50-50, 50 on table, 50 later. 1 year mortality, maximum 5 years, 6 years. There are people who have survived 10 years also. So it depends condition to condition, patient's condition. How serious you are, how you believe in yourself, how you can fight this, and also how you manage yourself after the surgery.
Correct.
Because post-surgical management is also tough. It has to be like you have a restricted life, restricted movement and all this, and because that can, if you just go beyond the given line parameters, it might, you may get infection, adverse effect, infection and all those things. So to know about this, then again 50-50 they said, then it is again question mark. 50-50, what do we do? So you know that half full, half empty.
Yes, glass.
Kritika's approach was that it is half full, no, we will go for it. Her condition was so precarious to tell, because later stages she was on almost oxygen day in and day out and all these things. She used to carry her portable oxygen cylinder and all these things. So all these things made her realize one thing. She used to tell me, there is no point in living and becoming dependent on somebody. We will take that chance. That is one chance available. Tomorrow you should not regret that you could have taken that chance.
Correct.
Suppose something happens to her without getting into that surgical option which was available. If something happens to her, she was thinking that I should not get into that guilt conscious, that something was available, you didn't try, kind of a thing.
Right.
So that was the thing. And then finally we said we will go for the surgery. And one more thing she was telling, even 1 minute of that free air, she was so fed up with this artificial support of oxygen. Even that 1 minute of free air, if I did, that is enough for me. That is the kind of mental thing. Even though she is a fighter, she fought all the things, but reality dawns at some point of time in life. Then you understand your own situation, condition, whatever it is. So she said that then we didn't had any second thought about whether to go for surgery and other thing. So we said, okay, we will go, we will take this chance. And she was also very clear about that.
It takes a lot for the patient to be the one telling the family that let's go for it. And
yeah, because in these cases, the determination and willpower of the patient is more important, I think, because they should have the confidence that what course of action they are taking, they believe in it, and they can overcome whatever hurdles that comes in the way and all this. This is the thing.
It is so nice that she thought of you in a manner
Absolutely,
that
I think.
it's beautiful, right?
But for her, probably left to us, we would not have taken that decision so
it
easily.
is scary.
Scary, really,
It is very
because
scary.
we didn't had much details of this transplantation. And everything was new to us. So we have to really go hard on researching various aspects. See, once we take the decision, then again the research starts. Because it doesn't end with decision.
Yes.
Because, okay, decision was taken, but what next? Doctors will guide us, but still we would like to know who is the one who is putting knife into my daughter's this one to do the surgery and all this. So all these things matters. No mortality rate, as I said. Then what is the cost? Cost, how much it will happen? Post surgery, what complications will arise? And how we should be guarding her, kind of a thing, in terms of exposure to natural environment, how it will help her. And after all these things, we said then family discussion. Because support is important. Only father and daughter cannot decide about what is going on in her life and other things. Family has to be involved. So my son is there, daughter-in-law is there, wife is there. Mother has to accept first. She should be able to understand what is happening. And she should know. She will get overwhelmed by the things what is happening around her. So we have to sit with her, convince her, and at least explain her what is the course left for us. And we have to convince her this is the only option left for her. Then she also agreed. And of course, my other family members, son, daughter, everybody agreed for it. And then we took a formal decision saying that, yes, now as a family, we will go for it. So it was a mutually acceptable thing for the family that we will take this chance and we will see later what it is. So
how long did you take to say, yes, I'm ready, from 2018 when they said?
2018 was it started. So probably 20th 2020, early 2020 or so, we formally decided that we could go for
2 whole years.
2 whole years to
research,
contemplate,
communication,
research, discuss and all this. Because see, for a middle class family, it is not an easy decision. Because so we have to do research about how much it will cost, and post surgery how cost is going to impact the family, all these things. So for us it was a difficult situation, but no decision is they say no small when it comes to life. So we had to take that, we took that decision. Then next is which hospital. The treating doctor who initiated us to the transplantation journey, that hospital was not doing. It was doing, but it was doing only in Chennai. Apollo Chennai was doing. Apollo Bangalore it didn't. So we also contemplated whether we should get it at Chennai. We met those doctors also, everything. But see, logistic problems, cost involvement, and unknown place. You go somewhere, get your daughter a major surgery, people support, family support and everything you will be missing when you go out of your own town, all these things. So these were the things which we were contemplating. We have even discussed in Chennai also whether we can do it around everything. Then we said if something is available in Bangalore,
Yeah.
why not? And we have to zero in on the doctor also, no?
Correct.
So one of the doctors suggested surgeon from KIMS Hyderabad. So now again, whether we have to go to KIMS Hyderabad, whether we have to do thing, how do we manage?
Yeah.
All these things. I see a decision is there, then there are you step back.
Yeah.
Because logistic and other things which comes. Practical issues which were involved. But family was, we have to go for it. That's all. What comes, we will see.
Yeah.
So then luckily what happened, one day we got the call from that KIMS team which was doing it. They said that they have a arrangement in Bangalore.
Okay.
So the surgeon will visit whenever there are such surgeries are there.
Yeah.
So he will do it. The treating team will be here only. And luckily we knew that doctor from the earlier team. So
nice.
that made that comfort level you get, no?
Yeah.
When you know a doctor and other thing. And my uncle was also there. He helped us a lot in coordinating and all these things. So then the process of transplantation has seriously begun. Now what is the first step? Then said you have to register because there is an organization called SOTA in Karnataka which monitors all these transplants.
Okay.
So we have to register that there. So that is governed by the state government and other thing. So they will monitor the thing. So we have to register that and we will be in the queue.
Okay.
So there are each kidney, heart, there's lungs, liver and all these things. Every organ which has to be transplanted, the patient has to register first in this one. So then we ask what is the probable this one. See, organ when it is available, how do you know? The two lungs. And it has to be a cat liver transplantation that only from brain dead person you can take it.
Okay.
It's not a live person can give how can you give the lungs?
Correct.
So it's only a brain dead patients. Then afterwards we don't have any control. We just anyway medical attention is being given as and when required and all these things. Then if this one is available, organ is available, hospital give us a call. That so and so there is a possibility of organ available.
Okay.
Kind of a thing. And before calling also they would have seen because medical history will be available, data available with the hospital. So they would have blood group. Okay, O positive, O negative, O negative. That matching is already they will do it. And then this one size also they will know
of the organ.
Whether suitable to the patient or not. So that also they will take it.
Okay.
So all these things, if that matches, maybe overall it matches, they will they will call. Okay. They will intimate the patient and ask, "Are you ready now?"
Okay.
Are you ready now? And other thing. See, before that the cost element is there.
Yeah.
Before this, this comes the secondary because the moment you agree for the this one moment you want to register through the hospital to SOTA. Whatever the package is there, that you are supposed to deposit.
Understood.
With the hospital. So only when all these things are done, the call will come.
Right.
That is their policy, hospital policy and other thing. So that call comes and then the patient is asked to come. If they say yes, because many a times they may not be ready. If the patient is not available at that point of time, everybody should be available. No. In our case, Kritika's case, what happened? He was on a study, tour, something on a workshop. He had gone to Manali or something. So he was not there. So the call came.
Yeah.
So what do I do? Then immediately I called him. He said, "You go, I'll come." This is what he said. So we went, but there are cases where the person, family support is not immediately available. They may say at this point of time we are not ready, not ready kind of a thing. Luckily for us, everything fell in place. So that was the first call which came, accepted. See, there are chances even for objecting when you shift the patient to the hospital. There are chances that it might not match.
Okay.
Because they do one thing called cross matching, where you got in-depth blood analysis they do and all these things. sometimes that fails. In Kritika's case, it matched.
Everything matched.
Everything matched. So 20th September she got, 21st September she got admitted. 22nd this one happened.
And can you talk about the concept of harvesting? You mentioned how there is variables even in that aspect.
Pardon?
Variables to that aspect as well. What is harvesting?
Harvesting is that they take out the lung when the patient is ready. This one. See what happens. It all depends on the donor.
Correct.
Donors have to accept. I think this the time I should say, really express my gratitude to that donor, whichever donor who has done, because we are not supposed to meet them.
Correct.
Because it becomes emotional issue for both the giver and the taker, kind of a thing.
Yeah.
So they harvested. Immediately the team was there. The preparation has started. 21st I told you, no. 22nd was surgery. She was taken around 12:30 or so to the this one.
And
she
how
came
long
out
was
around
it?
10:30 night. Almost 10 hours.
10 hours surgery. Wow.
10 hours on this one. And
My
doctor,
God.
surgeon was quite happy when he came out of. He was tired, but he said,
Successful.
Success. Luckily for her, I don't know. I should say luck, because we had taken the decision and other thing. Within 3 months, she could get it. And one more best thing that happened was the donor was in the same hospital where Kritika was being treated.
Oh, wow.
So that logistic problem was taken, because there are cases when it flows from one state to another state, one center to another center. There the gap will be there, and because they have some statutory timing of harvesting. Once they take out the lungs or any organ, that has to be. Each one has a different timeline.
Right.
So since it was in the same hospital, it was easy. In fact.
Right. So now you mentioned the cost factor in all of this. I think that is, as you rightly mentioned, how that is something that a middle class family especially will think a lot before making such a decision. So
see, now medical science has improved so much.
Yes.
Everything is available for a cost.
Yes.
So whether we will be able to afford that or not, luckily God has been great that we could mobilize those funds. Correct. And get it done. So we have to be ready for, see, they say package.
Yeah.
So package for entry to discharge, that's all.
Yes.
Once
After that,
after that it is there, and in between some complication comes, they say it is not included in the cost and other thing. So some extra days in the ICU or whatever in their scheme of things, if it is crossing that thing, they will be charging. So for that buffer also you have to keep. You can say yesterday whatever the amount they have said, we have deposited and we are free now. That cannot be. In our also it escalated for some time.
Okay.
Some amount it got escalated. That's okay. But the thing is unpredictability over post-surgical cost.
So you have to always keep that contingency in place.
And that's what I told. No, that time when she got this one, there was no much knowledge about the cost.
Yeah.
Because the number of instances were less and other thing to get even how much it will cost. They would say condition of the patient is important.
Correct.
You will start with this, but how it goes, it all depends on this one. So it's very unpredictable. So there's no how should I put it? But we have to be ready.
You have to be ready.
Because it happens. No, sometimes it happens. Package somehow you will arrange.
Yeah.
Package amount you will.
And now above and beyond.
Beyond that, if it happens, no, if you are not ready for that, you will get stuck.
Yes.
Because
and you can't stop
the whatever
procedure.
decision you have done, that might not work out for you.
Correct.
So come what may, you have to be ready with those kind of finances and other thing, because it's a lifelong process.
For sure.
Because any small infection, admission, further test and all these things will be there. So it is a recurring expenditure.
Correct.
So that's what I also suggest at the hospital. When you counsel the patients or their relative, the caretaker, you should also give them one estimate. Package is fine.
Yes.
Okay.
That's one-time payment.
So it is all other things extra if you put. How anybody can this one?
Yes.
At least what is the minimum? See, there is a minimum dosage of medicines you have to take.
Correct.
How much it will cost per month? Okay, 20K, 30K, 15K, whatever it is. You should give some thing.
Ballpark figure.
A ballpark figure.
Yeah.
And additional, again, if there is a hospitalization, additional comes,
Yes.
addition comes. There is a lot of tests, repeated tests happens to see that the donor lung is functioning properly. It is
So at least
adjusting.
give a cost for the non-negotiables.
Yes, that's
Yeah.
what. And they can also give, suppose this particular test is compulsory,
Yes.
this will cost this much.
Correct.
So at least you can be ready, prepared
yeah.
for that. And as I told you, most of these middle class people, they have very difficult to arrange finances. So in beforehand, if they know, at least they make some effort to see, and at least that will also determine taking decision, to be frank.
Correct.
Otherwise, if you get stuck with finances, and neither this side nor that side, you will get really sorry for yourself, kind of a thing, because you have put your hand in something where you are not able to
Correct.
manage it, kind of a thing. So you have to be very careful about that.
Now let's discuss post-surgery steps to be taken by the patient, by the family, the care to be taken, everything that goes on after the surgery itself.
Yeah. Now, normally after the surgery, 21 days they will be in the hospital. That is the normal period.
Okay.
Again, depending upon country, but that is the minimum, 21 days. In that, almost about a week or 10 days, they will be in ICU, and then they will shift them to the ward.
Okay.
See, basically, they should not get exposed to external environment.
Okay.
Because the body is immune to, they get infection very fast because the body is so weak after the surgery, and other thing, new organ is inside. So to avoid all those things, they say hygienic condition. Nobody is allowed. In ICU also we were not allowed, especially for 2 days, nobody is allowed inside.
Okay.
We were not allowed. Only we can see from the distance, that too after 2 days, 48 hours. You can just see from outside at that distance, this one. And afterwards, we have to wear that gowns and other things, like in COVID period, how that masks and everything were there.
Yeah.
So all those things were, we have to wear that, go that to from a distance and other, because outside we will be carrying lot of impurities, germs and other things external. So that should not be transformed to the patient, because they are so weak. So then again into the ward, nobody is allowed except the caretaker, whoever be there.
So one caretaker?
One caretaker. Once the condition is fine, when they decide the patient can go to home, they are discharged and other thing. Again the same thing, a specific room, fully hygienic, nobody is allowed inside except the caretaker, again with the mask, gown and other thing, what they would be.
All of this at home? At
home also you have to have that thing. So you have to have that arrangement made, whichever it is. So basically hygienic environment, not exposing to the external world.
Correct.
Until, for Kritika it was about 3 months. The doctor also feels that, yes, now you can, small lenience is okay, you can start walking at home itself. And all these things. And also they will have, the hospital can arrange, or there is some exercise to be done and other things. So because you have to expand the lungs.
Okay.
See the new lungs which has come now with their breathing exercises, some other free exercise that they have to expand that. So maybe balloon, blowing the balloon or blowing the candle or some weight, this one, because they have to also increase the weight.
Right.
This one. Slowly they should start building up their muscles, say especially chest muscles, to protect the lungs, hold the lungs and other thing. So that also will be there. So either you can arrange, the hospital can arrange for somebody visiting the thing, and unless and until there is anything emergency, no need to visit the hospital or something like that. Maybe they will tell one particular test has to be done, we have to go to this one. That also secured environment we have to go. I can't go by auto or that thing, because you should not get exposed. Basically to protect the patient. These all restrictions is to protect the patient.
So how did you manage to go?
We used to go by, in fact we have taken a house nearer to the hospital, but still there also we used to go by car.
Okay. All windows up?
All closed. Maybe we have put AC or whatever it is. But it was not, since it was about 500 meters from the hospital, we took it for logistical purposes. So Post surgery, 3 to 6 months have to be proper care of the patient. So you have to really make her strong enough to go to the next phase of her life, rebirth. We always call it as a rebirth for the patient. So to manage her life and the way. Once they are comfortable, once they are doctor says now things are okay, then they can also go out and all these things. And they cannot go to a street side vendors, pani puri, bel puri kind of a thing. Hygienic location.
Correct.
Some fine dine restaurants where hygiene is maintained and all these things. So they have to go. And there will be dietitian. You have to take food as per the dietitian's requirements. So whatever they say, they calculate everything, iron content, protein content, that and all these things. So slowly build up those things. So that they will guide.
Yeah.
There is a team which interacts with each other. The physician who gives instruction to the physiotherapist what kind of things to be done, or to a dietitian. So this is the condition, then you take over kind of a thing.
Wow.
And so all these things, this keeps on happening.
So
there will be
many
regular
more doctors other than just
it is a
pulmonologist.
Surgical, it's a team. You have dietitian, you have physiotherapist in this case, especially lung and other thing. Then you have a physician with you. Then there will be a counselor.
Right.
See, it is also a psychological issue for the patients, because isolated for so long, their mind gets little wayward here and there. So just this one. That's where the family support comes. Because when they are alone, when they feel frustrated for things, this one. So there the family support. They have to be with them, involve them, make them feel comfortable and all these things. Everything, that's where the thing. That is very important. That family support and whoever, friends. So even though they are not allowed, but at a distance, after 3 months, 6 months, you can sit in a room at a distance, discuss and all these things. Give them, pep them and all these things.
And especially Kritika, who loved being a part of social gatherings.
That she was finding it very difficult, but she has her own way of keeping herself busy. So in that way, we were lucky, because she is a different kind of she was a different kind of a person. She took 1,000 piece one puzzle.
Wow.
So she used to engage herself with that and all this. See, at the end of the day in life, everyone finds their own way to keep themselves this one. But this support group is necessary, spending time with them, because they should not feel alone. That is important. That loneliness should not come. That they should feel that people are there around. So that support is there and all these things. So I think things would work out. See, basically, main thing is that you have to take care of yourself. The patients also have to take care of themselves. If doctor says this should not be done, it should not be done. See, having gone through such a risky procedure, you have to obey to the doctors, whatever they say, you have to manage it. So that things will be in your control, medical condition will be quite satisfactory. You can lead your normal life. See, there is a normal means what normal to you may not be normal to the patient, because they have a different level of normalcy. You cannot go to a crowd. That is a normal for them. You should not, I can go, but patient should not go there because of the crowd and all these things. And basically they tell in closed environment, like your cinema hall kind of a thing, you should not visit.
Where there's no ventilation.
No ventilation, so much crowd is there, you should not go, kind of a thing. Marketplace.
That is so important to understand.
This is patient should understand. Patient should also understand. At the same time, what happens many a times, families should understand the patient. Their changing medical thing, requirements and other thing, and post surgery, what they want and other thing. Because they're, as I told you, this one psychologically also they get disturbed very fast. Their what I call change of moods keeps on changing, and family should understand that. If they don't understand that, unnecessarily it leads to, you start arguing things with the
Yeah.
patient and all that. It doesn't do good for anybody,
Yes.
kind of
So,
a
I
thing.
mean, supports at so many levels:
Yeah,
emotional,
yeah, everything.
psychological,
Because there go lot of
financial.
emotional changes.
Yes.
Emotional changes will be there. Family should understand, especially the caretakers who are day in and day out with their thing.
Yes.
They should understand the patient.
Yeah. So, after how long could she finally step out of the house?
I think 6 months, 6 to 7 months,
6 to
she
7
was
months.
out on her own,
Okay.
and she joined this one, some organization, started working from home, and later stage she started going to the office also.
I mean, it's so nice to know of her journey and the fact that she was finally able to step out. And that one wish that she had, I don't want a oxygen cylinder by my side and I want to breathe fresh air by myself. That finally happened for her. So she must.
Yeah, we can really see her enjoying that
Yeah.
moments, kind of a
Yes.
thing. Yes.
So now coming back to the main thing, that all of this was possible because of organ donation. So what do you have to say about this concept itself? Like how important it is in current times.
Yeah, organ donation. No, now with lot of medical what you call
Advancements, right? Yeah.
advancements and other thing. Now the organ transplantation has become much more successful in
Correct.
India, and in India that awareness is happening, but not to the extent it is there elsewhere.
Yes.
So my own experience with that organ donation, Kritika could get a fresh lease of life and enjoy her time, and family could also spend
Yes.
some that wow moments with her out of the medical condition.
Yeah.
Even though there is restriction, but it was not like what it was before.
Yes.
So she could do many things what she wanted to do,
Yeah.
kind of a thing. She could add value to her life
Yes.
and create those impacts which was so very well imbibed in her character. So everything what she wanted to do, she could do it in her
Yes.
own this one. So it's a gift of life. So
Correct.
there is lot to be done in this field. Lot of awareness has to happen. So it should become as a part of a movement.
Yeah.
So that people know like how do you do charities and all these
Yes.
things. Organ donation also should come in that this one. So there has to be a lot of awareness from the society. And what society? We are part of society. What we can do for that? This is what we have to look at. That having gone through our own experiences, I strongly feel that we have to give back something to society.
In this matter, Kritika found a foundation, right? Like she founded a
Yeah.
foundation. So, can we talk about that and let everybody know why she took that step and how you would like to, and we would all like to carry forward that legacy?
No, basically, as you know her as a cousin, what kind of a person she was. So she wanted to bring in those her thoughts into a constructive manner and do something for the society.
Yeah.
So after this one surgery, when she got new lease of life, and then she thought that she can do something
Yes.
constructively, she opened a foundation. It's called Vruddhi Foundation. So in which she thought she could do collectively as a part of the society uh, on education, on people, downtrodden people, to give education, women self-help groups.
Yes.
She wanted to create, and then in education she wanted to do something. And we, as a part of that foundation, we thought that organ donation is
Yes.
also something which we have to do, so that we can give this awareness to people, so that they can come forward and take this as a mission, and then start spreading this, so that people get benefit out of this.
Yeah.
And all these things. So we can
And the
do
impact is multifold, right?
naturally, because it's a what you call, I can tell, very very, as I said, life after life. Some of you is there in somebody's life which is
Yes.
doing, and people who have donated, they can also think that okay, now for example, Kritika donated her eyes.
Yes, I was
Okay,
coming to that.
donated. Now I have a satisfaction that her eyes are somewhere in this universe,
And
somewhere.
it gave sight to 2 people.
Yeah, it gives sight to two people.
people.
So that's how it happens. No, that one satisfaction. She is not there as with physically, she is not there with it, but she has given sight to 2 people who are looking at this beautiful world.
Yes.
So that is the thing. Similarly, you can have heart transplant, heart donation, liver, kidney, tissues,
Yes.
lungs. So whatever
it's a
they say, 7 to 8 organs can be used for different purposes. Why not? If it can be done, why not?
Why not?
So in that process, Vriddhi Foundation wants to do what best it can do in their own limited purposes. Hopefully, it gathers momentum, and this is part of that to tell the story,
Yeah.
our own experiences,
Yes.
because we have gone through it, so that we can share this
Correct.
with this one. Fine. Let's see how it goes. Yeah, first of all, in this whole process of organ donation, our family's sincere gratitude to the person or he or she who has donated lungs to my daughter Kritika, which gave her 3 years of extra uh, life, kind of, and which she could achieve many things which were very impactful to the people who were in contact with her. So we would like to appeal to whoever watching this, or through you to other people, that organ donation is a very noble act. So we would like to you to come forward and then register yourself for organ donation. So we from on behalf of Kritika's legacy and as Vriddhi Foundation, we also will be there to give awareness to the organ donation, to clear the myths and the misconceptions it may have. We will try to do that. So please come forward, register with SOTO. The links are available in the description, or you can go Google it and find out. That the end result is that you should be donating your organs, so that somebody else will get benefit out of our lifetime. This is what our request. So please do it.
Yes. Thank you.
Thank you, Naina, for this, what I should say. Though emotional, I am happy that we are able to give something
Yeah.
to the people to ponder it over and come forward and donate organs. Let them do their research. Our bit is to share our experience.
Correct.
And then make them aware how it can help the such patients who are in line with the requirement of organs and other things. So let them do their research, meet their people, but take a decision, donate your organ, and then do good. What this is nothing, no cost kind
No
of
cost,
a thing.
yeah. And
so this is another act of charity, which is always very noble.
yes.
So please ponder it over, think it, and do it. And I hope you will come forward and do it.
Thank you.
Thank you.